The information in this presentation is about the Ctape, the competency test for adapted physical education. There are 6 areas that I will focus on for this information. First, the developmentally appropriate. Second, criterion reference standards. The age group for this test. The 8 steps to assessment. The equipment that's needed and the areas that are tested. First, it's developmentally appropriate. IDEA mandates inclusion of physical education instruction in special education program of all students with disabilities. Physical education is defined as physical and motor fitness, fundamental motor skills and patterns, skills in aquatics, dance, and individual and group games and sports. The Ctape is also standardized. It differentiates between children who have average motor skills and children who have significantly below average motor skills. Second, is criterion reference standards. The percentage of scores are provided in guidelines related to physical education program placement, an assessment supplement for use with students whose scores are at or below the 19th percentile. The Louisiana Task Force on Adapted Physical Education discriminates between children who have average motor skills and those whose motor skill development is significantly below average. And this test is also reliable and valid. The reliability is the consistency of measure. Ctape is the second most common assessment, both in middle school and high school levels, to determine eligibility for students with disabilities. It's also valid. The extent to which an instrument measures what is supposed to be measured, a standardized assessment tool. The ages range in 6 different levels and go from 6 years to 15 years and older. It's a great test for those middle school and high school age, but also is appropriate for younger students as well. There are 8 steps to the assessment. Step 1 is to select the appropriate level to be administered. Step 2, read through the test and gather appropriate equipment. Record the personal data on the summary sheet. Include any pertinent information. Step 3, begin assessment by administering the test, preferably in sequential order. Testing must be completed within 5 days, but may be completed within 1 session. Note items that have practice trials and items that should be demonstrated. This information is supplied in the margin next to the individual items. Record the score for each part of the item, circling the appropriate score. Step 4, compute the totals for each item and record the total score in the box in the lower right-hand corner. Step 5 is to transfer the total item totals to the summary sheet provided for the test level. All possible scores are not presented in the summary sheet, so make a circle approximately where the exact score will be located. Step 6, count the number of circles falling to the left of the bold numbers. Bold numbers represent passing scores. Multiply the number by 4, subtract this number from 100 to obtain a percentage score. Step 7, identify the level of deficit. Identify strengths, weaknesses, and individual needs. Provide recommendations for instructional services and make a professional recommendation for programming and appropriate for IEP committee consideration. Step 8, copies of the test and score sheet, the summary profile, should go into the Adapted Physical Education teacher file. The deficit percentages are indicated here. 70 to 100% indicates motor skills that are average. 69 to 45 indicates mild motor deficit. 44% to 20% indicates a moderate motor deficit. And 19% to 0 indicates severe motor deficit. The equipment varies by the age and the level. Most of these will include a cloth softball, basketball, volleyball, soccer ball, football, some bean bags, a standard mat, cones, individual mat. When we're at the first level, there's very few equipment that's needed. But necessary for everything is a stopwatch, tape measure, a ruler, masking tape, pencils, chalk, and equipment bag. All balls are regulation size for the activity. The areas tested are items that are appropriate for the age of the student. They include locomotor skills, manipulative skills, body and spatial awareness, balance skills, sports skills, fitness skills, and gymnastics skills. I've also included some supplemental resources. There's a fillable PDF for the Ctape, but an account is required to use this. There are some scoring samples and as well as some assessment examples to look at. Here are the references. And that's a Ctape.